Welcome and thank you for listening to this webinar on the COVID-19 pandemic presented by REI Engineering in Wausau, Wisconsin. At REI, we specialize in providing comprehensive services with solutions in civil engineering, land planning and surveying, environmental consulting, and regulatory compliance and safety consulting. Our goal is to continually exceed our clients' expectations. Today, we will be discussing the Central Wisconsin employers' response to COVID-19. This presentation is a special session of our Power of Peers Safety Roundtable group. The group normally meets quarterly at the REI office in Wausau, Wisconsin to discuss pertinent safety topics. The goals and objectives of Power of Peers are to collaborate with our business peers in manufacturing and industrial services and provide a platform of information sharing and education. This webinar was originally presented via Microsoft Teams on Wednesday, March 25th to a record number of attendees from our peer group. Since then, it has been updated with current statistics and comments from our peer group for this public release recording today. If you are interested in joining our Power of Peers group, I'll share contact information at the end of the presentation. We would love to hear from you. My name is Erin Henderson, and I'm an industrial hygienist, environmental and safety consultant, and skilled team member at REI Engineering. My work experience includes 2 enlistments in the Air Force as a bioenvironmental engineering technician. I have a bachelor's in environmental management and a master's in emergency management. Today, we'll be talking on the background of COVID-19, the effects on the United States, the effects on the manufacturing industry, challenges in the manufacturing industry, and best practices, resources, and preparation for future events. While I was developing this presentation, several individuals from Central Wisconsin companies emailed me some practices that they have put into place at their facilities. Those will be included in the best practices session. Thank you to those individuals for providing us the information when we were developing this webinar. For some background on COVID-19 or the coronavirus, it was first identified in Wuhan, China. That case actually occurred in November, but it was not identified as such until December. There was an exponential increase as the virus went around the world. The first 100,000 cases took about 3 months to occur, and you can see then the every successive 100,000 cases after that took much less. Currently, as of today, March 28th at about noon, we are at about 629,000 cases. There is very likely more undiagnosed cases due to test shortages. And you are probably watching this webinar several days from now, so the numbers have likely increased dramatically since it was recorded. This graph shows the number of daily cases throughout the world. If you look at the middle of the graph, there's a spike in the middle of February. That shows the result of a change in diagnosis classification. About a month ago when I first saw this graph, that spike looked really dramatic. But as you can see how more testing was done and the virus has really spread across the world, that spike is now tiny compared to the steady increase in cases during the last 2 weeks. The last line on that graph is yesterday, March 27th, and that shows 64,501 new cases. The first case in the United States was identified on January 20th, 2020, and that involved someone that had recently returned from visiting China. The current US cases, again, as of today, March 28th, about noon, we've got 112,000 total cases. Most of those are still active. Out of that number, about 3,200 have recovered, and there has been 1,873 deaths and counting. In Wisconsin, the current cases are a little over 900, with also most of them active. 2 have recovered, and there has been 16 deaths. And those Wisconsin numbers include 64 new cases that were reported so far today. This graph shows the increase of cases in the United States. You can see that those cases were very steady until about the middle of March, and then there was a pretty dramatic increase since then. This has, without a doubt, had a tremendous effect on the United States. We are now the highest number of cases in the world. The last day on that graph is March 27th, yesterday, which showed 18,691 new coronavirus cases in the country. The effects on the United States, we've had a national state of emergency. There is a massive unemployment rate expected. According to estimates, there are about 37 million jobs in the US that are vulnerable to, at a minimum, short-term layoffs. And most of those are happening in food and beverage services and clothing and retail sales. Now, the total workforce in the United States is about 160 million. Keep in mind that the total population of the United States is 327 million. Those numbers were from about 2 years ago. And that means that just under a quarter, about 23% of jobs could be lost for at least some time. Some additional effects, you're listening to this and you're in Wisconsin, your children are home from school. Schools have closed across the country. As far as I can tell, I can't tell that all schools in the country have been closed, but there are closures in all 50 states. This is going to affect at least 55 million children, and the schools will likely be closed for the remainder of this school year. And there's been a massive economic blow to many industries like the hospitality, retail industries. In Wausau, our mall closed, and Kohl's nationwide reported they were going to shut down their stores for a short period of time. It's also hit the transportation industry. Flights have been canceled and people aren't really using public transportation. And personal services, spas, salons, and barbershops have also closed. There was a survey done, the National Association of Manufacturers, and about 3/4 of manufacturers in the country are expecting a financial impact. About half expect a change in operations, and a significant number are experiencing supply chain disruptions. There is going to be and has been a decrease or stoppage of production for some industries. For example, Harley-Davidson suspended US production on March 18th. However, there is also a demand for increased production in other industries. There are some local companies in Wausau that have added extra shifts for productions. In Minnesota, 3M has started to double production on N95 masks. So these employers are seeing, a need to quickly onboard new employees. Employers also need an increased, ability to be flexible in production. And the reason for that is the National Production or the Defense Production Act. This allows the president to require companies to prioritize government contracts and orders that are seen as necessary for the national defense. The goal is to ensure that the private sector is producing enough goods needed to meet a war effort or other national emergency. President Trump has authorized the act. Now, that in itself is not significant because it's been authorized about 50 times since it was first created 70 years ago. But as a few days ago, he hasn't really invoked it yet for sure. It sounded like he wants some companies to volunteer rather than forcing them to make that switch. But within the past day, it appears that the president may have invoked the act when he ordered General Motors to make ventilators. But at this time, no US manufacturers have begun doing this, which would be a problem for car makers. They would be starting from scratch. They know how to make cars, not ventilators. So they would need to know first how to do it, and then a transition of production over and find out, what their capacity issues are. So flexibility is important, and this has happened before. During the Korean War, auto manufacturers shifted to tank production. And now what we are seeing, Hanes Underwear Company, they are switching over in some locations to, instead of producing underwear and shirts, they are making protective masks. And distilleries, especially a lot of local ones in Wisconsin, they are shifting their production from grain alcohol to hand sanitizer. The manufacturing industry is definitely seeing some challenges. If you have tried to purchase any PPE like N95 masks or nitrile gloves, you are basically not able to buy them at this time. And they have been impossible to purchase for several weeks. And that kind of thing was needed even before the pandemic to protect workers from workplace hazards. Some other challenges are remote work is just not an option for most production workers. They are needed out on the production floor. And we mentioned earlier that with all those kids out of school, there's going to be some childcare issues because a lot of daycares are also closed. So we've got employees that maybe have to call into work to take care of their kids. Companies are also needing to restrict vendors and visitors from their locations. There are some supply chain disruptions. If you've tried to buy anything on Amazon in the last week or so, you'll see that they're getting shipping estimates about a month out when normally you could get something in 2 days. And they're also having difficulty communicating with clients, vendors, and employees. If you have had any additional challenges at your company that you've seen during this crisis, we would love to hear from you. You can send us an email at ehs@reiengineering.com. And throughout the remainder of the presentation, you will see questions kind of bolded at the bottom of certain slides, and we would love to hear from you on those too. We'll talk about some best practices. We'll start with prevention. Basically, don't allow anybody in your facility who's been in contact with a confirmed case in the facility. Don't allow anyone with the COVID-19 symptoms in your facility, and as the CDC has published, are generally fever, cough, and shortness of breath. Of course, keep up to date with your CDC website because it would not be surprising if those symptoms change because I've seen some other ones reported. Also, you'll want to limit your visitors and vendors to the facility, cancel non-essential travel, and avoid shared or common use items. One company in our area has issued employees personal styluses to use to avoid using a common use touchscreen. So if your facility has implemented any additional prevention efforts, again, please let us know at ehs@reiengineering.com. And of course, you are having most likely problems obtaining PPE. From several resources, we have come up with some, optional solutions for you. If you use an N95 mask for welding fumes, consider a PAPR. If you use an N95 mask for dust, you can use a half face or a full face respirator with HEPA filters. We've also received an email from an OSHA employee that didn't specify the hazard exactly, but says that OSHA would understand if employees were using like a surgical mask instead of an N95 mask, depending on the type of hazard involved. But they do say also that if you are experiencing, some supply shortages, make sure that you document your attempt to purchase the correct PPE. If you have an email or documentation from the supplier saying it's out of stock, make sure you save that, and then plan on switching back to the appropriate respirators as soon as you can. And there are other like substitutions for nitrile gloves, which are also in shortage. If employees are using them for solvents, basically just go to the next highest level of protection. And you can contact REI for any questions that you have on gloves. We maintain a database that shows the best types of gloves for the different chemicals. And if your company has implemented any creative PPE substitutions, please feel free to let us know about it. For best practices, social distancing at work, first, stop food sharing. Like we're in Wisconsin, we love our potlucks, but don't have any potlucks and don't have any communal dishes. Consider closing your break rooms, vending machines, water dispensers, and microwaves. Maintain space between employees. You may need to alternate shifts, allow remote work whenever possible, stagger shifts to avoid overloading at the time clock. One local company has changed their break times so that no more than 10 people are on break at the same time. And all of this, all these efforts are to flatten that curve and stop the cases from spiking. For sanitation, we would like to know, does your company have a protocol to follow if an employee tests positive for COVID-19? The CDC has implemented some recommendations for employers. If you know that somebody has tested positive, you will want to close off the area that they were in as long as possible before you begin the cleaning. You'd want to open up outside doors and windows to increase air circulations. And if you can, wait 24 hours before beginning your cleaning and disinfection. The cleaning staff should clean and disinfect all areas that are used by anybody that's been sick, focusing especially on frequently touched surfaces. The CDC also recommends that you clean surfaces with detergent prior to disinfection, just to get rid of the surface dirt, and then do your disinfection. You've got some options here. You can do a bleach dilution, alcohol solutions with at least 70% alcohol, common EPA registered household disinfectants, or the American Chemistry Council has a list of approved products, or the EPA has List N, which is a list of disinfectants for use against SARS-CoV-2. Even if you don't have a positive COVID-19 case in the facility, you should increase your housekeeping practices, disinfect common surfaces frequently, disinfect production stations between employees, and some companies around have also hired additional staff just for housekeeping. You'll want to, or another suggestion that a company has done is they've implemented mandatory hand washing and touch point sanitizing to occur several times during the shift. And make sure that the people who are doing your cleaning and sanitation are wearing the proper PPE. If you have any input on how your facility has increased sanitation practices, please let us know. For communication, we recommend creating a company response team, and some local companies have done that. They meet regularly to discuss the changing situation and make decisions. Consider maybe establishing a private social media group just for employees. You can also do toolbox talks with your employees, communicate good hygiene practices and PPE expectations. One that I thought was interesting, and this is a larger company in our area, but they had set up a hotline that is staffed by HR representatives that people can call in, the employees, if they have any benefit and leave questions. And they also have an emergency absence system for employee leave based on risk. So we ask you, how are you communicating? Do you send info from like the CDC or other sources to your employees? Are you doing any feedback like survey websites or using any tools like Teams, Skype, or email? But you'd like to share how your facility is ensuring that communication is maintained, please let us know. For best practices, information technology, if you have remote workers and you're using a VPN, make sure that the number of licenses you have are sufficient for your employees. Another option is to utilize cloud-based services like SharePoint or OneDrive. Ensure essential workers have the resources to work remotely. Like if employees have laptops, that's great, they can take them home, but a surprising amount of employees actually don't have a laptop and just use a desktop computer, which isn't as easy to take home. But you should allow your employers or your employees to borrow their work setups, like monitors or keyboards. I even brought my work chair home. And consider adding hotspots for employees without adequate internet. If you have any IT resources that you'd like to share that your company has provided for remote workers, please let us know. Along with remote work, we have to consider emotional health. And this is something that people aren't really thinking about that often. Some recommendations are to maintain a schedule, avoid staying up late and sleeping in, and maintain your hygiene. Take a shower, change your clothes, brush your hair. But it's important to take breaks too. A lot of people find themselves more productive at home because there's less distractions, and they'll end up, staying at your home office for 8 or 10 hours straight. So we want you to take breaks too. use board games. I brought out a giant bin of Legos to play with. You can also read books, go for a walk. In Wisconsin, at least, the parks are still open to stay off the playgrounds. And, consider, if you're working at home, kind of enhance your office, your office space in creative ways. I stole a bunch of my daughter's toys to set up, and I have a window next to my home office desk, so I put up a bird feeder so I could watch those during the day. And it's also important to stay in touch with your work squad. I've always considered myself to be very introverted, and before the pandemic, I actually called myself a reclusive dragon. But after working from home for less than a week, I really missed my coworkers and realized how much I missed interacting with them. So stay in touch with them. At REI, different work teams meet throughout the day and during the week to stay in touch and maintain communication and figure out where everybody's at. If you're working from home, maybe consider meeting with your squad on video chat for coffee a few minutes before your workday starts, or maybe on Fridays have a virtual happy hour and grab a drink from your home office, with your coworkers. I recently attended a webinar that was put on by some emergency and infectious disease doctors, and this topic, emotional health, was discussed. And one thing that they said that stuck with me was to enjoy this time as much as you can, working from home for such a long time, because it is likely that you will not have this opportunity again in your lifetime. So if you have any, creative ideas at your company, what you're doing to maintain emotional health, please share those with us. For business continuity, you want to make sure that your remote workers are kept in the loop regarding business operations. As I mentioned on the previous slide, make sure that you have regular virtual meetings to foster communication. And you'll want to maintain contact lists and stay in communication. You want those lists to be of your vendors, customers, and employees. And, maybe also have alternate vendors if your supply chain issues occur, and consider domestic versus overseas just to reduce the amount of time that supplies would take to get to you. An additional consideration is, what will you do if your facility closes, like altogether? You should have a plan for sudden closures, whether they are temporary or extended. Having an operating facility with your employees present, 3 shifts a day is kind of a type of security for your company. But what will you need to do if you need to actually close down your facility, and how will you protect millions of dollars of inventory and assets? One local company with a lot of inventory has increased security measures in case of closures. They have some additional physical protection for security guards, like plexiglass around their booths. And they also have additional cameras, and they've revised their security protocols. Also consider any perishable items like food or chemicals that you have in the facility. A lot of restaurants that had to close needed to get rid of perishable food, so they were donating those to employees or to other groups. Just kind of consider a plan for any chemicals that will degrade or expire. If your facility needs to be staffed 24/7 to prevent a disaster from happening, make sure that you review your emergency action plan for critical shutdown procedures. The next slides just have some resources. These are general ones, local and insurance resources. Family resources for childcare providers, and also to get school lunches for your kids. There are some health resources, for example, the Wisconsin Department of Health Services, some coronavirus hotlines, and locations where you can get coronavirus testing. Please keep in mind that, at least at the Marathon County Health Department, there is no testing being performed there. And then we've got some resources for HR and employment. Some of you may have seen that last link from the Wisconsin Economic Development Corporation, which states that employers and companies that are deemed essential must implement a COVID-19 response plan. If your company does not currently have one, feel free to contact REI and we can help you develop it. So preparation for future events. This is new ground for everybody, and we will not know the full effect of this pandemic until well after it's done. But there are some priorities, and the first one is business continuity. You want to make sure that your company can continue going during this disaster. So to do that, you would want to establish a planning team and develop a business continuity plan, which we'll talk about in the next slide. Then implement the plan, review, and revise, and also update your emergency action plan and integrate that with your business continuity plan. The contents of your business continuity plan, it's going to be very specific to your company and its functions, and a template plan will just not suffice. You'll want to perform a business impact analysis, and that's going to list all of your company functions like sales, marketing, payroll, production, and determine how long the company cannot perform that function without causing significant financial losses, significant customer unhappiness, or significant regulatory fines and penalties. You'll also need to list all of your resources, which can include IT, vehicles, PPE, supplies, and personnel. And you'll want to identify vulnerabilities, risks, and hazards, especially as I mentioned before. Do you have critical functions that must be maintained 24/7, 365? Or what will happen, to that function if employees just can't come into work? And you will want to work to mitigate those risks and also identify roles and responsibilities. Now, most companies probably don't have a business continuity plan, but all companies that have at least 10 employees need to have a written emergency action plan per OSHA. And the OSHA requirements on that plan, there's not actually many requirements, but you need to have procedures for reporting a fire or other emergency, procedures to be followed by employees who remain to operate critical plant operations before they evacuate, procedures to account for all employees after evacuation, procedures to be followed by employees performing rescue or medical duties, and the name or job title of every employee who may be contacted by other employees who need more information. Most company EAPs cover just fire, chemical spill, severe weather, and medical emergency. More recently, due to local events, companies have started adding active shooter or bomb threat procedures. And one thing, just kind of consider revising that EAP to include pandemics. Basically, pandemics can happen a couple times a century, and I don't think any of us expected this, 4 or 5 months ago, but it's definitely something to consider. And then integrate your emergency action plan with your business continuity plan. If your company has a plan in place for pandemics or other disasters, we would like to hear about it, so please feel free to email us. I'd like to thank you for listening in to this webinar. We love to hear all of your feedback, and we'd love to meet all of you. Feel free to contact REI Engineering for any assistance. Our email address, again, is ehs@reiengineering.com. During this, this pandemic, we can help your company with customized solutions for emergency action plans, business continuity plans, the COVID-19 response plan for essential businesses. We can also help out with online training sessions for your employees and development of written safety programs and more. And please contact us if you have any questions, if you would like to be added to the Power of Peers meeting group, or if you would just like a PDF copy of this presentation. Thank you again.